A full hemogram is something known to most, if not all of us. More often than not, when you go to a healthcare setup, you'll be sent to the lab to do a full hemogram. And then when the results come back, there's a whole list of things and you wonder what are these. So in light of the full hemogram, today we are going to look at white blood cells and their types as shown. There are 5 types of white blood cells. We have neutrophils, they are the largest in number, basophils, monocytes, eosinophils, and leukocytes. And these cells are normally divided majorly into 2 types. We have granulocytes and agranulocytes. TMI, I know, but walk with me. When I say granulocytes, I mean these cells, within them, they have granules. When I say agranulocyte, means no granulocytes or without granulocytes. So they do not have any granules within. The granulocytes are neutrophils, basophils, and eosinophils. The agranulocytes are lymphocytes and monocytes. In the beautiful fabric of working in unity to make sure that your body is well protected, the granulocytes and agranulocytes work differently. So the granulocytes, which are in this case the basophils, eosinophils, and neutrophils, work by 3 major ways. Number 1 is by inducing an inflammation. Number 2, inducing an allergic reaction. And number 3, it is phagocytosis, which is the cell eating up the enemy. So it just ends. The agranulocytes, which is the monocytes and the lymphocytes, normally work to alert the rest of the soldiers that something is not right, and they do that by producing chemicals that call the other cells to come to the rescue, and also subsequently it is keeping a record of what has happened in the body so that they are ready for the next one, which is what you call adaptive immunity. So say you've had chicken pox, and then these are granulocytes. I'm like, okay, fine, we've had chicken pox. How does chicken pox look like? 1, 2, 3. So in the event you get chicken pox next time, what do we do? 1, 2, 3. That's the job of our granulocytes. So this is how these different cells work together in unity to make sure that we are well protected. How beautiful, right? So when you come to the functions of these cells and how they are able to help health workers determine what might be going on within the body system, it is as this. Neutrophils, as you've said, are the largest in number of the white blood cells. They are the first responders to any kind of inflammatory process going on in the body and are commonly present in bacterial and fungal infections. Basophils, on the other hand, tend to show up in large numbers in whereby we have allergic reactions. Monocytes increase in number when there is bacterial infections. Eosinophils, on the other side, tend to be elevated when there is a parasitic infections. And lastly, lymphocytes normally are elevated when we have viral infections. So that whole list of things you normally see in your full hemogram, which might not make sense to you, is very, very important in directing making of a diagnosis or starting the management of a patient to the health care provider. It may look complicated and a lot and confusing, but it is very, very important.